Thank you all for joining us today. I'm excited for today's session on Public Health Pathways information session. And I am your moderator for today. My name is Tracy Seward. I'm the Senior Director for Educational Pathways and Undergraduate Education at the Association of Schools and Programs of Public Health. So I have great esteemed colleagues with me today to present on their programs. First up, we have AJ Perlman, who's the Director of Public Health AmeriCorps. We have Heidi Pfeiffer, who's a Public Health Advisor with CDC. Michelle Roth, who's Public Health Analyst for the CDC. Jeff Ockendine, who is the co-founder and president of Health Career Connection and author of You Don't Have to Be a Doctor, Discover, Achieve, and Enjoy Your Authentic Health Career. And Denise Blake, who is the Senior Director of the Office of Workforce Development for the New York City Department of Health and Mental Hygiene. So with that, I'm going to turn it over to our first presenter, AJ, but I will let you know we will be collecting questions in the Q&A all throughout the session, and I will moderate the questions when all the presenters are done. So with that, I will stop sharing and turn it over to AJ.
Great. Thanks so much, everyone. I'm going to go ahead and share my screen with you, and we'll go ahead and jump in. So I hope all of you are having a great afternoon, morning, wherever you may be joining us from. I'm really excited to talk to you a little bit about Public Health AmeriCorps. I am the Director of Public Health AmeriCorps, and I would say you're going to learn about a number of different pathways into public health today, and we're excited that Public Health AmeriCorps can be a part of this webinar. So just jumping in, for those of you who don't know, AmeriCorps is a federal agency that's really focused on volunteerism and national service, and we provide opportunities for thousands of Americans to serve in their communities every year. And so really, this is an opportunity to engage with your community, to serve in a variety of capacities, and we have a range of programs at AmeriCorps. But what I want to talk with you about today specifically is Public Health AmeriCorps. Public Health AmeriCorps is a partnership between AmeriCorps and the CDC that really grew out of what we learned during the COVID-19 pandemic. Now, what we saw was that we had community members across the country who jumped in day one to help with the public health response when the COVID-19 pandemic hit. So what we also saw was that COVID really pulled back the curtain on the shortage in the public health workforce and the need for more individuals to engage in our communities' public health and addressing our public health needs. So with that being said, Public Health AmeriCorps really is this innovative collaboration between two fields, the public health field on the one hand and the field of national service on the other. So we are taking this innovative solution together to really try and both address the workforce shortage and provide opportunities to join the public health workforce. The goals of the program are twofold. The first is to really help meet the needs of the public health needs of local communities. We do this by increasing capacity in the form of people power in local communities by supporting Public Health AmeriCorps members who serve in their communities in public health settings to really get on the ground experience and give back in those communities. At the same time, we are working to provide pathways to public health related careers by engaging and supporting members who reflect the communities in which they serve. And our goal really is to build that next generation of public health leaders, which is why I'm so excited to talk with you all today. So let me tell you a little bit about what Public Health AmeriCorps members do. Members are placed at nonprofit organizations, at public health departments, and other organizations that are working in public health all across the country. We have members serving in almost every state and in Guam and Puerto Rico. And the coolest thing I think about the program is that the funding is flexible enough to allow Public Health AmeriCorps members to serve depending on what the needs of their communities are. So we have folks who are doing opioid screening and counseling. We have folks who are doing nutrition education or chronic disease prevention. We have folks who are supporting mental health training or doing outreach and education around HIV and STI prevention. Really, individuals are engaging in a wide range of opportunities in the public health field. And I like to say that it really represents the breadth of opportunities that are available to folks who are interested in a public health career. So I talked a little bit about the types of activities, but let me just run through those. We have opportunities to serve doing community outreach and engagement, doing health education and training, system navigation, helping folks access healthcare and breaking down some of those barriers that may exist, as well as opportunities to really build capacity. So thinking about data analysis, research, data collection, policy support in local public health settings. And that type of work is incredibly important as well. You may be wondering, what do members get out of it? First of all, Public Health AmeriCorps is providing hands-on, on-the-ground experience in public health. But in addition, members receive a living allowance, so you are paid for your service. Members also have access to foundational public health training that has been developed by CDC. And there are real opportunities for career development, for networking, and other professional opportunities. As just one example, we took a number of our Public Health AmeriCorps members to a national public health conference earlier this year, provided training and support on how to do an elevator speech, on how to engage with public health professionals, and then the members got to attend the 3-day conference following the training. Finally, at the completion of your service, you do receive an education award that can be used either to repay your student loans or a portion of your student loans, or can be used for future educational opportunities. So I think I'm running low on my time here. I just wanted to highlight a few of our members. This is Jada. She served at Pima County Health Department in Tucson, Arizona this past year. And we are really excited that she's going on to be getting her master's in nursing in the coming year. We also have Jasmine Walker. Jasmine is a Public Health AmeriCorps member who served in Richmond, Virginia as part of Recovery Corps, where she did peer recovery support and counseling. And she has been hired on by her host site and is now working full-time as an employee for them. And then finally, Fareed Howard is one of our members that's serving at Los Angeles County Department of Public Health. One of the coolest things I think about Fareed is that he was not engaged in public health at all before joining PHA, and through his experience there, he has both signed up for a second year of Public Health AmeriCorps, and he's now seeking an undergraduate degree in health communications. So with that, just if you're interested in learning more about Public Health AmeriCorps, you can go to americorps.gov/public health, and you can search opportunities by state. So check out the programs that are available in your state, or if you have any questions, you can email us directly at publichealth@americorps.gov. And with that, I think I'm going to, we'll hold questions till the end, and we'll go ahead and I'll be on towards the end of the webinar and happy to take questions from you all. But for now, I think I'm turning it directly to Heidi Pfeiffer with the CDC, who's going to tell you a little bit more about the Public Health Associate Program.
Great, thanks, AJ. Tossing it over to my colleague. I like that. My name is Heidi Pfeiffer. I'm going to share my screen here really quickly. Let's get up my slides. Okay. And just tell me when you can see. Technical difficulties. We've got backup plans just in case. 1 second. Well, while I'm doing this, my name is Heidi Pfeiffer. I am with the Public Health Associate Program here at CDC in Atlanta. I'm coming to you from Atlanta as well. And the program itself is otherwise known as PHAP, P-H-A-P. And Tracy, for some reason, I can't pull up my slides, so I'm going to have you do that for me as a backup. That's what we have backups for. Okay. So I'm going to talk to you a little about another fellowship at CDC that we offer here, very similar to what AJ talked about as far as some of the requirements, but I'm going to talk to you a little bit more in detail about what it's like to start a career within public health, not just volunteer with the AmeriCorps, with all the steps there, but talk a little bit about the Public Health Associate Program. Okay, so let's go to the next slide. Very simply, if we look at the mission of what the CDC program is all about, it basically is, the mission is to provide a training and experiential learning, and that means hands-on. And you can go to the next slide, Trace. Hands-on in the field at a health department and you can stop right there, working on boots on the ground back in the field with the programs of choice. They're referred to as host sites, but it's meant for early career. People who want to work within public health but not really sure how to get into it. PHAP's a really great program because it's a 2-year competency-based program. It is based within CDC's training. You also get some field work as far as getting, like I said, boots on the ground. You're hired by CDC. You are considered a CDC employee, but you're assigned to a unique field position that can be located anywhere in the United States. We have associates, we call them associates. We have associates in Alaska and Maine and California, Puerto Rico, and even in the Pacific Islands and Guam and Hawaii. And really, we don't know where we're going to be placing people within those sections because it really depends on who applies for one of you for the entire year, but you are considered a CDC employee. You do benefit with the CDC benefits as well, and you get support not only from CDC staff, but you get support basically from CDC themselves, as well as a full-time mentor that helps you out throughout the process. Next slide, please. Well, what is the eligibility? What's pretty easy. You've got to be committed. You first of all have to have an interest in working within delivering hands-on public health within the United States, and really have a passion towards working within public health. You need to be a U.S. citizen, permanent resident, or U.S. national. And you need to have received a bachelor's within the last 2 years or by July 1st of the starting of that PHAP program, which is normally in October. So if you're in school now, you're not going to be finishing until next year, you would qualify. And as you can see, the grade point average is listed, and then you have to be able to be willing to relocate at your expense. We don't know where some of these host sites are going to be every year, but of course, we're not going to expect you to move to Guam if you can't. We will try to accommodate you. Initially, when we first started PHAP, we didn't have a lot of people host sites applying. So we had what we had and you had to choose from that list. But now we're getting, 5, 6, it's sometimes even, I think it was 300 or 400 last year for hiring 160 or 70 associates a year. So you definitely, we have some opportunities, but the goal is that for you to be able to move at your own expense, but still be paid and work for CDC. Next slide. The following slide that we'll talk about really talks a little bit about the characteristics of other way, Trace, is the big picture. What we want, we'll have Trace catch up here, not a problem, is characteristics of what is a PHAP associate look like? What skills do you need to have? Well, we've used the word the best fit, which is really the acronym we use. Perfect, Trace, thanks. And what we want people who can see and think the big picture, people who can think outside the box, to see how PHAP works and see how PHAP works within public health. We want to make sure that you have strong oral and written communications. You don't have to be the best speaker because we'll give you some training, but we want you to be able to be speaking clearly and succinctly when you're working with the public. PHAP associates want to learn and have and can and be willing to learn how to work with individuals from different social and cultural backgrounds while being respectful to everyone's differences. And we look for people that are flexible. Flexible meaning like this. My slides wouldn't come up. Tracy jumped in. We just did it. We were pretty much as flawless as possible. And that's the whole point. Public health changes dramatically day by day. We know that. We've been through 4 years of COVID. It's changing. So we want people that can be flexible and are okay with change. We want somewhat of a good academic requirement. And we also want to make sure that you understand your learning is going to be tactile. You're going to be out in the field. It's not going to be all virtual. It's not going to all be computer learning. It's going to be out in the field. You'll be seeing people. You'll be going out into the beaches. You'll be going to digging wells. You'll be seeing people who might have gonorrhea or situations where you never thought you would do, but it's tactile learning. So it's truly hands-on field work. Next slide, please. Okay, well, what kind of work do you guys do? The most important thing to understand is that it really depends on the host site. The host site determines what their need is. For example, let's say Seattle King County says we have a huge problem with diabetes and we would like an associate to work diabetes. Well, then that would be chronic disease. They would apply for someone to come work chronic disease. And let's say Iowa says they have a huge STD or STI problem, then they might be STIs. So as you can see, this is a good representation of programs that our associates would work in. Similar to the AmeriCorps, there will be days that you could be teaching people how to eat, little kids to eat broccoli in school. And then some of your colleagues in the same cohort might be going out and finding HIV patients. So it really depends on the actual site, the host site itself. But as you can see, here are some examples. Next slide, please. One thing that we know, and it's unfortunate, but our associates are called upon to do and respond during public health emergencies. During COVID, many of our associates were out in the field doing contact tracing. You are an asset for CDC and are utilized in that way, meaning that if something is to happen and you have a special skill, you might be asked to deploy. It's all paid for by us. It's all on us. But this is an opportunity for you to not only get your 2 years of public health experience, but also to get experiences like this when it comes to emergencies or any type of a situation that happens in the nation. So that is another plus that we have here working within the PHAP program and being a CDC employee. Next slide, please. Here is the real simple application timeline. In the winter and spring, right about now, okay, is when host sites are looking to figure out how do we want to get an associate, okay? Winter, when I say winter, first, I think it's the second or third week, I think it's in January 2024, is we open up the candidate applications for 1 week only. And it's all done through USA Jobs. So if you do not have a usajobs.gov account, I would go in after today's seminar, open up an account, get yourself set up, create your resume, because that is where we post our positions, is through USA. Most federal positions are through USA Jobs. The process for PHAP is 3 phases. The application through USA Jobs. So once you make it there, it then comes to CDC. If you're triage through there or weed it out to the point that we've picked the top 100 or 200 or 300, we actually do a personal statement, and then we actually do a face-to-face interview process. During the spring and summer, which we just did selections and making connections to your host sites. Hi, Christine, do you want to go to Iowa? Do you want to go to Missouri? Do you want to go to Boston? And really the whole idea is we try to make this fit for you, but what you have to understand is that we don't know, and we sometimes can't guarantee you're going to be on the East or West Coast. We've been trying to make them somewhat palatable for everybody, but understand public health is very transient and it likes to give outbreaks here and there and have problems. So we really try to do the best we can. And then in October of the following year, when you apply, so if it's 2024, this October is when our new class will start. So there is a time frame between there, and a lot of it has to do with us just getting all of our ducks in a row, being a federal agency, making sure we have the best candidates. But that just gives you a little picture of our timeline in a nutshell. Next slide. For more information, the best place for you to go and more inclusive is going to be our cdc.gov/phap. That's exactly where there's more information. There's a lot of great information in there, including some testimonials, more FAQs, our email, as well as right now, as you can see, candidates are open January 2024. You keep that site because that's where it's going to tell you when we start opening up our host site. So usually it's a second or third week within January, but it's only for a week. So make sure you guys kind of keep that in your radar so you can know when to apply. And next slide, I think that is it from me. Well, no, this is the picture. This was a picture of a graduating class. So yes, you could be one of those people if you're interested in working in public health, be a CDC employee, spend 2 years in the field, and then eventually help us create the next generation of the public health workforce. AJ talked about that was one of the goals and incentives for AmeriCorps, but it's for PHEP as well. That's the whole goal here, is to reinvigorate the whole workforce for public health, to make sure we get the best and the brightest and the people who really want to do the work within the agency and for the nation, employed in doing that work. So I, like AJ, will be around to answer questions. So I am not going to toss it off to one of my other colleagues at CDC. I think Michelle Roth. Is Michelle there?
Hello, I'm here. Thank you so much. I appreciate the opportunity to speak to everyone today. I'm going to share my screen. Okay, and I'm also going to post this link in. Is everyone able to see my screen?
Yes.
Yeah, so I'm going to talk a little bit about the Lewis Scholar Undergraduate Program and the Ferguson Fellowship Program for graduate students. These are both programs that are managed under the CDC Office of Health Equity. And we have 7 recipients that actually design, implement, and execute these programs. And so because there's 7 programs, they're all a little different and a little nuanced, but there's some overarching similarities between all of the programs. And I'm going to focus on the Lewis Undergraduate Scholar Program today. So the Lewis program, what the recipients do, and we have 7 recipients, as I said. We have the University of Pittsburgh, the University of Michigan, Ann Arbor, UCLA, Kenny Krieger Institute, which is out of Baltimore, and the Southern Plains Tribal Health Board, which is a tribal serving organization out of Oklahoma. And there is Morehouse College, which is an HBCU here in Atlanta. And so those are our 7 recipients, and they all are similar in that they have application sites that people go to apply to the program. And to be eligible, you must be an undergraduate student who has at least 2 years of undergraduate coursework under your belt. Successfully completed, and that includes a 2 year of community college is also perfectly fine, and or you could be a postgraduate, but no later than 1 year finished with undergraduate and not yet started with graduate school. And so when you, assuming you meet those basic eligibility, and then also there should be a indicated interest in health disparities and advancing health equity. So a tip, if you are applying, and I hope everyone does apply to these programs, that you in your personal statement speak to your interest in reducing health disparities and advancing health equity. So the programs, and again, this is the site with all of this information. Here are different Lewis Scholar program sites. And you can go to each one and read more about the nuanced information in each site. So I'll just use Columbia right now for an example. Go to Columbia. Perhaps. All right, I'm going to show you, I'm going to get Columbia to load. I'm going to show you just the site for the University of Michigan. So this is their Lewis Scholar program, and each Lewis Scholar recipient has their own name for their program. So for instance, the University of Michigan, their program's name is the Future Public Health Leaders Program. But you can see in their logo that they, make it clear that it's also part of the CDC John R. Lewis Scholars Program, the undergraduate program. And so the Michigan Flip program, it opens on November 1st. So that's coming up. That's an application date that you can be aware of. When the application does open, you'll have an opportunity to submit your resume, your transcript, 3 essays, and 2 letters of recommendations. And these required components are similar across all of the recipient sites. And I'm going to show you one additional program. This is the Lewis Scholars Project Imhotep project. So this is the Morehouse College's Lewis Scholars program. And again, they have information on how to apply, and their application, I believe, is currently open. So you can click apply now. This might be an older yeah, that might be an older application site. Yep. So this is the 2024 application site. So with the Lewis Scholar program for Morehouse College, it's already open. Also, Southern Plains Tribal Health Board application is open, and Kenny Krieger Institute's application period is application site is open. And I believe that there is no, I think those are the 3 that are open right now. And the other ones, UCLA, University of Michigan, Columbia University, and the University of Pittsburgh, their applications all open on November 1st. Applications close for all of our sites, all of our recipient sites on January 31st. And so I've been giving you a lot of application information. You're probably not sure what the program is yet, perhaps. So the program is similar across all of our Lewis Scholar recipient sites. You are paired with people who have successfully entered the program, and it's a competitive program. Our entrance rate is varies between years, but anywhere between 8 to 12% is the acceptance rate. So it's very competitive. When the scholars entered, once the student is admitted into the program and enters the program, they become a scholar, a Lewis Scholar. So Lewis Scholars have 8 to 10 weeks at their on-site at their recipient site. So if, let's say, you were accepted into the University of Michigan's Project Flip program, they would fly you to Michigan, and you would live there in Ann Arbor. You would spend half of your time taking classes and coursework and curriculum in public health, which is what we call the didactic portion of the program. And then you would spend half of your time working with a mentor that you're paired with. And you'd be working with your mentor either on site or in a hybrid model. That would depend on your what you agree on with your mentor. And you would be working on an applied public health project. And so this all happens over the course of 8 to 10 weeks. At the end of the 10 weeks, all of the scholars from all our recipient sites, there's approximately 300 people that are accepted every year. They all come to CDC in Atlanta for what we call the CDC Summer Showcase. And you present the work that you did with your mentor in that applied public health experience program at the CDC Showcase. And it's similar to a poster that you would present at a conference. And this provides you an opportunity to share with the CDC audience your public health experience, your technical expertise, and your subject matter expertise in a particular public health topic area, and also share your enthusiasm for advancing health equity and reducing health disparities. And so that will conclude my presentation. I invite everyone to go to this site and click on the links and look up the different recipient sites and apply to all of these great programs. Thank you so much.
Thank you, Michelle. Next up, we have Jeff.
Good afternoon, everyone. And it's really good to be with you, and really great to be part of our esteemed panel of programs. One of the things we haven't mentioned yet is that part of why we have this collaboration is we're really hoping that we have people that are part of one of these programs, say the Lewis internships programs. If you were in that program last year, then we're hoping you might be in Health Career Connection, which I'm going to talk about now. Hoping after Health Career Connection, you might go into the Public Health Associates program, Public Health AmeriCorps, or the Lewis program if you hadn't done that already. So we're excited. We want you to have as many opportunities as possible to get into your pathway to discover your authentic health career and get into the public health workforce. We really need you. So I'm going to share my screen and I'm going to talk about Health Career Connection. Can everybody see that, Tracy? We got that?
Yep.
Okay,
Perfect.
so Health Career Connection, also known as HCC. This is our 34th year that we're going into. I'm the founder and the CEO of HCC, and we're all about inspiring, empowering you all to become the next generation of diverse health leaders and professionals. Like the Lewis program, we focus on people who are undergraduates. We also, though, do have folks that are recent graduates within 3 years out of their undergraduate program, but not graduate students, but people who are maybe figuring out their path or having some gap years. And we are open to everyone. And at the same time, we know that people from certain backgrounds are underrepresented in the health profession, as are people who are from under-resourced communities and people who are first in their family to go to college. So we're all about providing people with life-changing, career-launching opportunities to get into the public health field. We've done this for now over 5,000 of our alumni who have participated in HCC, and they've gone into public health, including Denise Ferrarazzo, who's the Chief Public Health Officer for the city of Detroit, or in healthcare or in mental health, and even life sciences. But public health is really our heart and soul. We want the public health workforce to look more like this picture, representing people from all backgrounds. It looks more like our population, people with the language skills, the cultural knowledge, to be able to really improve health equity and improve health for their communities. We have a pretty good track record of being able to do this. The interns recommend HCC to their peers. Some of the best recommendations for interns come from our alumni. We're very proud that during the program, people build professional skills that enhance their ability to go into public health and advance health equity. They strengthen their network. We have a saying in HCC, it's either network or not work. So we really help you to be able to strengthen your professional network. And then 71% of our students either get a job offer or an extended internship as part of their HCC experience in our network. So we really are good at launching people into the public health field. I mentioned our mission is inspiring and empowering. This is a study we did of our alumni last year. These were the words that they used to describe their HCC, not only their HCC experience, but also being in the alumni community for many, many years. And so you can see the words that we're all about in terms of our mission are right here. And we want you to experience all these different things. This is an example of Felix, who's one of our alums from a few years ago. And you can just see, how he came into it really not knowing what to expect. And this really got him into the industry, and he's doing amazing things going forward. So we want you to have similar experiences. We also are all about having our alumni get into graduate schools, and a big part of HCC is graduate school preparation. We have graduate school workshops and how to pay for graduate school, how to get into graduate school. We partner with Tracy from Association of Schools and Programs in Public Health. And with these partners, these are our public health and medical school partners, and 82% of our HCC alums go on to complete their graduate degree within 10 years of their HCC experience. We provide paid full-time internships, and primarily in the summer, in a cohort model where in certain regions you'd go through the experience with other people from different backgrounds, from different schools, who all have similar kinds of passions. And you get paid. It's a 10-week full-time, 10 consecutive week program that you get paid for being an HCC, and our stipends are we're trying to work to increase our stipends because we know cost of living is high, and people, you all deserve to get paid well. So we're working on this. We do this all over the country. We have virtual internships from wherever you are. We also have in-person and hybrid internships all throughout California, throughout in the Midwest, and throughout several locations in the East Coast. You can, no matter, so if you're living in California and want to try doing an internship in Boston in the summer, or vice versa, you can apply to that. And when you apply, you can apply for the region that you live in and any of these other regions if you're interested. Unlike the Lewis program, we don't fly people out to the programs, though. We don't provide housing for the program. So if you apply, it'd be good to know where you're going to be based and where you have housing. Lots of people find housing from relatives or friends, or at lower cost things that are available in the summer. We have a comprehensive program that is in addition to your internship placement. You get placed in a health organization, hands-on, to get that experience with a mentor. You also are part of our comprehensive cohort-based professional career leadership development program. So we want you to really get that hands-on experience to decide what you really want to do, and then be better positioned to be able to do it. We want you to have mentorship from HCC and the organization that you work with and our partners. We're all about building community and a sense of belonging, because you all do belong in the public health field, and want you to know that and build that connectivity. It's health career connection, right? And we're about increasing your skills, as I mentioned, and your competencies. And we have workshops from some of the leaders in the country who are advancing health equity, advancing public health, and building the skills and the relationships that you need. We have an apprenticeship model that when you're in an organization, you actually get paired with a preceptor in a variety of these different kinds of settings. And they provide you with hands-on experience and meaningful project work that benefits the community, applied public health kinds of projects. These are some examples of our health department partners. We partner with many others, but these are some examples around the country. You can see everywhere from Los Angeles to Northern California to Boston to North Carolina and DC and Baltimore. And we also have Minneapolis and some others that are part of our network as well, Mecklenburg in North Carolina. So we have a partnership with the Big Cities Public Health Coalition. So we're trying to get more people to have opportunities that are available, and with NACCHO as well. And then we also, for those of you that can't do a full-time program, we have something called the Health Equity Scholars Program, which is a 8-week part-time, half-time program that you also get a stipend for participating in. You do team-based projects around health equity and get a lot of training around health equity, racial justice, culture, humility, skill building, and those kind of things, and still have a cohort that you get to work with. And so this is possible for those of you who have to go to summer school or have to work part-time or studying for the MCAT or something with the GRE, something like that. So you'll have to be part of an undergraduate program, and that includes community college, like Michelle mentioned as well. You don't have to have completed your 2 years yet, but it's helpful because we're putting you in situations where you really get great experience and leadership opportunities. But again, recent graduates within 3 years can apply. People who are post-bacs can apply. It's not for people in graduate school, unfortunately, or people who are in sort of high school taking community college programs. Our application is open. It opened last week. The deadline is earlier than the Lewis program. It's December the 11th. So time to get those applications started. And we wanted you to be able to get them done before the holidays and before finals and those kinds of things. And the way our program works is that you would apply in December. We would have you do an interview with Health Career Connection staff in January. And we are also looking for fit, as was mentioned earlier by the CDC programs. You get to interview with the host organizations. We don't just assign you there because we want you to see what you're getting into, and we want the organizations to see if there's a fit as well. And then we try to finalize your placement by late March or April, and then the summer begins. So that's a little bit about HCC. You do have to do a resume, some short essay, answer questions, and some summer preferences. You do not need letters of recommendations or transcripts. And then finally, I'm just going to end with, this is Dr. Evita Limon Rocha. She's one of our HCC alums. She is from the Inland Empire. and she became got exposed to advocacy, which now, in addition to being a child and adolescent psychiatrist, she is also an advocate working in public health and health equity in the community. She's on the board of the organization now where she did her HCC internship. And she's doing great things, and we show her there knowing that you'll be able to do these kinds of things too. So thank you. I think I put in the chat, or I will, our application. Let me make sure that gets posted, the link to our application. Look forward to you applying and joining the HCC family.
Thanks so much, Jess. All right, up next we have Janice, and I will pull up the slides.
Hi, everyone. Good afternoon. My name is Janice Blake. I'm sorry I'm not on video. My Zoom has been freezing today, and I'm just afraid that if I try again, I'll be locked out. So Tracy's going to do my slides. And can I just have a thumbs up and let someone let me know that you can hear me okay?
I can hear you. Can you see the slides?
Yes, I can. Thank you so much. Okay.
Perfect.
Again, my name is Janice Blake. I am with the New York City Department of Health and Mental Hygiene, and I am the Senior Director of the Office of Workforce Development. And today I would just like to share with you some of the public health programs that we have here at our agency. Next slide, please. We take this quote very seriously. Who will keep the public healthy? And this was from 2003, but we still believe it. To the extent to which public health institutions are able to address the complex of challenges of the 21st century and make additional improvements in the health of the public depends in large part upon the quality and preparedness of our public health workforce. And so here in the Bureau of Public Health Training and Information Dissemination, the Office of Workforce Development, we provide workforce development opportunities for those across the workforce spectrum. Next slide, please. So in BPH-TID, we focus on, again, workforce from across the spectrum. You'll see that we have pre-career programs for high school students or youth out of not connected to academia. We have early career programs, and then we have a preventive medicine program. We even have programs that we support our staff here as well in workforce development. Next slide, please. Through our FIA program, our Public Health in Action program, high school students have the opportunity to learn about public health and public health careers. This is a 3-series workshop designed by the staff here at the health department, and we tailor it to the needs of the school community that we are in. Through our PHCE, or Public Health Career Exploration program, the staff here in the Bureau coordinates a public health experience for select youth in the ages of 16 to 24. Participants in the program are called Explorers, and they are supervised by a DOH, MH, or a health department mentor, or a community partner who works in a public health organization. The Explorers, or the interns, explore a population health topic, and we are now in cohort 4. Our other pre-career opportunities for students exist in the summer. We have a program called Summer Youth Employment Program and Ladders for Leaders. And again, these programs are held here. The health department serves as a site, and then the students can apply. These are high school students, or again, youth through 16 through 24 are able to apply for these programs. These are condensed application process and does not require a transcript, as was stated in some of the other programs, but more so we are just interested in your interest in public health, and we try to meet you where you are. Next slide, please. So here is our flagship program, HRTP. So if you know folks early in their career, HRTP is perhaps a program for them. So HRTP has been here at the agency since 1960 and serves as undergraduate and graduate programs. HRTP is currently accepting applications. Our applications for our spring session closes on November 15th. We have a fall session, a spring session, and a summer session, and we invite you to participate. I see some HRTP alumni in the in the audience today, so I'm happy to see that you're here. Also, we have our New York City EPI Scholars Program. This program is for those in graduate school, also concentrating in epidemiology or biostatistics. We do welcome those students as well. EPI Scholars is a summer-only program. We have a public health volunteer corps, and those are for undergraduate students or recent graduates of an undergraduate or an associate's program, not going on to another program at this time, but we're not sure what you're doing next. We have our public health volunteer corps, which provides a similar opportunity to our HRTP program, and that again is an unpaid program. Our HRTP program is a paid program. Our New York City EPI Scholars program is a paid program. Our public health volunteer corps is an unpaid program. This is our YouTube video. I invite you all to, I don't know how much time I have. It's about a 4-minute video. I invite you to take a look, click on the link and visit the video and see what our interns have to say. One, it's not guaranteed, but we do sometimes have interns join us as staff, and this video will show you quite a few of the interns who did join us as staff, and some of them have moved on and they're doing wonderful things in wonderful places wherever they go. Tracy, do we have time for the video or should I just keep going?
Unfortunately, we're going to have to keep going, so we have time for Q&A.
That sounds great. Next slide, please. Again, we're considering workforce development throughout the opportunity. So these are our programs here. We offer our staff here, advanced staff, the opportunity to become preceptors or serve as mentors for the interns that we service here at the agency. So again, we have our public health career exploration program, our Lattice for Leaders program, HRTP, Public Health Volunteer Corps, the EPI Scholars Program, and the Preventative Medicine Program, where you do have to be a physician, completed medical school for that program. We invite you to consider the New York City Health Department as a place for you to continue to grow in your public health journey. We welcome you before or after AmeriCorps, PHAP, Lewis Ferguson, HCC. We just want you here. So we welcome your applications and we welcome your questions. Next slide, please. Whatever you do, wherever you are, as I leave you today, I just want to remind you to ask yourself, how are you filling your skills basket today? How are you filling your public health skills basket to get you to the next level? And just invite you to consider one or more of these programs as you move along your public health journey. Next slide, please. I do want to thank you for your time. My name again is Janice Blake. This is my email address. You can visit our video. We are on YouTube, or you can visit us at HRTP, and you just search us on Google or whatever your search engine is. Click on our link and learn more about our programs. We're also happy to take your questions in our email box. Thank you.
Excellent. Thank you so much, Denise. All right, well, we have just under 10 minutes now for Q&A. So if you have questions about any of the programs, I know a few have started coming in, but if you could put them in the Q&A box and we will start taking those. So one of the questions, I know Jeff mentioned the salary for the HCC, but there's a question about the other programs and about how much you pay on average.
Should I go ahead, Tracy? This is Janice.
Sure.
Or did you want to call an author? Okay. So for HRTP, we aim to pay all of our students. That is a commitment that we try to ask our programs to hold fast to. And so for we have quite a few programs, but our PHCE program is paid. Our HRTP program is paid, our EPI Scholars program is paid, and that can range from a stipend of $3,500 for our PHCE, that's our youth program, and up to $9,000 for the summer for our EPI Scholars program. Students are paid about upward of $15 an hour.
Thank you. Heidi, you want to talk about PHAP?
Sure, great. Well, I'll also put it in the chat as well. As we start our associates, it's a 2-year program. They start at a general schedule, a GS5, and then the second year they go to a GS7. GS5 and 7s, there's about a $34,000 or $36,000 base salary, and then there's of course a living, a cost of living accrual that happens for the location. For example, if you're in New York City, you're going to be getting a cost of living increase due to it being more expensive to live in the city versus a small town in East Iowa or a small rural community. What I'll do is I'll put some links into the chat where you can see where the GS5 and GS7 schedules are, as well as your cost of living as far as locations. I'll give you a good idea of what you would start at, where you would be placed. So,
Thank you. AJ, you want to go next?
Yeah, sure. I see the question is from Lindy with Trailhead, who is one of our amazing Public Health AmeriCorps grantee organizations. So she probably knows the answer to this already, but for others, Public Health AmeriCorps, through Public Health AmeriCorps, each of our organizations sets the amount of living allowance that is provided to our Public Health AmeriCorps members. And that number is different depending on whether you are serving in a part-time role or a full-time role, and part-time roles can vary dramatically in terms of the number of hours that you are serving. So just as a general sense, for full-time members, we provide between $27,000 and $28,000 per member to the organization, and then the organization sets the amount of living allowance and may use some of those funds to provide other resources, or alternatively may have other non-AmeriCorps funds where they can supplement the living allowance even further. So it's not as clear-cut of an answer, but just wanted to provide that general range in case it's helpful to the group.
Great, thank you. Michelle, still on?
Yep,
I think
I'm
she might
here.
have had to drop.
So,
Oh, okay, great.
yeah, so everyone who participates in the summer program across all the recipients, they're provided a stipend. The stipend amount ranges depending on the recipient and the location that the recipient's located in. It varies between 28 to 45 to 5,800 for the summer. However, all transportation is covered. So flights to and from your home to the recipient site, and then also to and from the summer showcase in Atlanta, are paid for by the recipient. In addition, housing is paid for. I think in most cases, health insurance is paid for. Some food costs and other included amenities are depending on the recipient site. So, but that's but it is a supported program. Yes.
Excellent. There's a question that came in that is about if you're already receiving your master's, if you're working on your master's, which of the programs are you eligible to apply for?
I'll start. This is Heidi. As long as you have a bachelor's and you're within a program within master's, you're eligible to apply, even if you're within your program of your master's, because you've reached, as long as your bachelor's was received within the last 2 years.
And likewise, if you're working on your master's degree, you're welcome to apply to HRTP. And if your master's is in biostatistics or epidemiology, you're welcome to apply to the Epi Scholars Program.
So we're wrapping up on time. There's some questions about relocation and housing stipends. I know you all talked about payment, but I don't think any of yours covered relocation or housing, correct? Okay. And does anybody have opportunities for remote work through your programs?
For Health Career Connection, we do have opportunities for remote work, both our Health Equity Scholars Program, which is a fully remote program that is a halftime program, and we also have internships that are where people can be fully remote, that hands-on 10-week full-time internships that could be fully remote as well.
Tracy, this is Heidi at CDC. We discourage within PHAP remote because the job itself is a field-based position where you're learning hands-on. So unless there's a specific situation due to situations within the health department, we shy away from remote.
And for the Lewis Ferguson program, the only recipient that is remote in 100% virtual is the Southern Plains Tribal Health Board.
And for New York City Health Department, we're moving away from 100% remote projects, requiring some on-site work each week. So even if a student is 1 or 2 days remote, they would need to be on-site for 3 days. And so being local works best, or within the commuting area.
And same for public health America.
All right. Well, I think we are just about time. If anybody has a last, this is just one thing I want you to take away. This is what I want you to bring back about my program. This is your time to share it. Do you all want to go around?
We want the best fit. I'll start at CDC real quick. AJ, I'm sorry. I jumped right ahead of you. I'm so sorry. That's the New York in me. I just like, let's just go. I think I can speak for myself or for PHAP. We just want the best fit. If you really feel you want to do the best work within the CDC or even within the nation in public health field, please look to apply. Look at the site. Many opportunities. If we're not a good fit, then maybe AmeriCorps is a good fit and maybe other HCC is a good fit. But definitely take a look at the sites that we send you, because one of us, if you're here today listening to us, there is some interest in public health. So please follow through with that interest. AJ, I'll let you. I'm so sorry about that.
No problem. Just about Public Health AmeriCorps, no experience necessary, no education requirement. If you're just looking to learn about public health and you want to get your foot in the door and get some on-the-ground experience, Public Health AmeriCorps is a great place to start. And opportunities across the country, both full and part-time, paid. So check it out, americorps.gov/public health. Thanks all.
And Health Career Connection, we really want to help you on your journey to becoming a public health professional, and please encourage you to apply. You'll get great hands-on exposure, experience, mentorship, and networking, and a good stipend, and you'll be well on your way.
And I just want to say, this is a ladder that has been laid out in front of you. Sometimes we say, but which way do I go? And right in front of you today, there's a ladder, right? You've got AmeriCorps, you've got PHAP, you've got HCC, you've got Lewis Scholars, and you've got the New York City Health Department, all the way from high school programs, no experience program, to the graduate program. There's a fit for everyone. And plus, you've got like 5 summers. Take advantage of all of them. Imagine doing a program a summer. Come on, folks.
I love that. Thanks. Michelle? All right.
Honestly, we need you all in public health. So, and now there couldn't be a better time than now to pursue public health careers, and more needed. So please join us.
I love what Heidi said. Find your fit. Find your fit.
That's great. Thank you all. Hopefully you will find a fit in one or more of the programs today. Thank you for joining us. We will get the recording out to you, and have a great afternoon. Can't wait to see what you do in your public health careers. Have a great day.